Hello everyone, today we are moving to lecture Pyoderma, Scabies and pediculosis. Pyoderma and bacterial skin infections which can take several forms including impetigocellulitis, folliculitis, boils and carbuncles. Impetigo is a superficial infection which is caused by strepto or staphylococcus that present as crusty lesions and that are contagious. Cellulitis is a deep bacterial skin infection commonly caused by strepto or staphylo that present as swollen, warm, painful skin red streak appearance. For the SS, because reddening formation is there, blister formation is there, that gives a burny appearance. Moving to pyoderma, bacterial skin infection, which is skin is the largest organ of the body and it maintains homeostasis, protect other tissues, organs from the mechanical and damaging substance and UV rays from the sun. The types of skin infections, they are bacterial, fungal and viral. For the bacterial infections, they are impetigocellulitis, folliculitis, boils, carbuncles and SS syndrome. Impetigo is a superficial infection of the skin which is caused by bacteria. The lesions are often grouped and have a red base appearance. The lesions open and become crusty and have a honey color which is typical of impetigo, which is contagious and can spread to all members of the family and also lead to reinfection of the children. So this is appearance which is like we'll call it as honeycomb color appearance. Moving to etiology, common bacteria that are found on the skin normally causes impetigo. When the bacteria enters an open area in the skin, infection is occurs. The most common causative organs are group A beta hemolytic, strepto or staphylococcus aureus. Impetigo is most common in children but adults also have it due to the poor hygiene and warm temperatures. Clinical features which is usually occurs on the face, necks, arms and limbs, but the lesion can be observed on any part of the body. Impetigo which can also start as small vesicles and or fluid-filled lesions. Then the lesion rupture and drain the fluids, leave the area that are covered with honey-colored crust. The lesions may look different with different size and shapes. The child may also present with swollen lymph nodes. For the diagnosis purpose, we should take the complete history, physical examination, then the lesions of impetigo are unique and are clearly diagnosed. The culture of lesions can be done to confirm the diagnosis and type of bacteria. Management, specific treatment is given based on the child age, condition and tolerance to the specific medications. For the treatment, we can give the oral antibiotics if the child has only few lesions. Topical antibiotics are directly applied on the affected areas. Bathing is needed with an antibacterial soap. Hand wash technique is needed. Then the fingernails should be short. Avoid sharing the garments to prevent the spreading of infections. Moving to cellulitis, which is deep bacterial skin infection, usually occurs in all the face, arms, and legs. It may happen in normal skin, but it usually occurs after some types of trauma opening of the skin. This opening can lead to infection. Etiology, which is caused by the bacteria of infection, a wound area of the skin that is no longer intact. The most common bacteria caused cellulitis include group A beta hemolytic streptococcus pneumoniae, and staphylococcus aureus. Clinical features: swelling will be there, warm skin, pain, bruising, blister, fever, red streaks will be there. Folliculitis is the inflammation of hair follicles due to an infection, injury, or irritation. The character features are tenderness will be there, swollen areas. Then the site which you can see the breast, neck, face, etc. Boils, which are pus-filled lesions that are painful and usually form, which is located under the waist area, under the arm, etc. Carbuncles, which are cluster of boils, they are usually found on the back of the neck or thigh. Then features like you can see pus in the center, irritated red follicles, damaged hair, and for the boils you can see pus in the center. Apart from that, whitish blood discharge from the boil. For the carbuncles, pus in the center, then whitish blood discharge will be there, fever and fatigue. For the diagnostic purpose, thorough medical history and physical examination is needed and culture of wound. Management, antibiotics we can give in this case. For carbuncles and boils, we should give the warm compression to promote the drainage, oral IV, and if it is possible, we should do the incision. Moving to SS syndrome or writer's disease, which is a response to staphylococcus infection, and it is cause reddening and blister of the skin, which give a scaled or burnt appearance, which is most common in infant and children, but can also affect the adult, depressed immune system, or problems with kidney functions. The condition can range from mild to life-threatening, though it is usually not life-threatening in children. And signs and symptoms. The condition often begin with low-grade fever and redness of the skin. The skin may feel like sandpaper or look wrinkled appearance. The rash usually spread quickly and especially affect the area over the mouth as well as the skin creased areas like arms, legs, necks, etc. Then this is followed by the formation of fluid filled blisters that rupture easily. The top layer of the skin may peel away off in sheets and revealing the reddish moist appearance. So in this case, Nikolsky sign will be positive. Diagnosis history is needed and gram stain or culture, skin biopsy, and PCR. Management pharmacology method is there. This is that systemic therapy. Either we can give orally in case of localized involvement or semi-synthetic penicillin. Resistant penicillin should be prescribed because of the staphylococci are usually resistant. Clindamycin and hydroxin is there. Meprazin ointment, erythromycin, colaxin. Non-pharmacological thing, which is the skin should be gently moistened and cleansed. Moving to scabies, which is an infestation of skin caused by the itch mite. It have 4 pair of legs and measures 0.3 mm in diameter, and which lives its entire 30 days life cycle in and on to the epidermis. The incubation period 2 to 4 weeks. Mode of transmission, prolonged contact, sexual transmission, formate transmission. Clinical features, common site like what are aspects of the wrist, lateral palms, interdigital sides of the fingers, axillae, scrotum, penis, labia, and areola in women. Altogether, this site is known as circle of Hebra. In this case, you can see severe itching papules or vesicles at the night. There will be severe itching. That is known as nocturnal itching. Surround the skin also will be inflamed, and sometimes on close examination, you can see the burrow, which means a tunnel of or the home of these scabies. The face is usually not involved in except in infants and immunocompromised patients. Also, you can see the scabies things. Usually, the secondary infections which lead to pustule crust and fever presentation. So this is circle of Hebra and this is burrow. Who are affected: immunocompromised patients, HIV and psychiatric disorder of patients, Down syndrome, and under immunosuppressive therapy. Treatment: all close contact of the patient, even if asymptomatic, should be treated. 1% of BHC lotion, scalp lotion, should be applied below the neck all over the body, then to be repeated with 3 nights. Then after that he can bath. Permethrin cream is there, antihistamine, antibiotics, and oral therapy with ivermectin 200 microgram. Prevention: maintain the proper personal hygiene, hand wash technique, and treatment and proper isolation of the case. Complications: secondary infection, which is also lead to the pus formations, plus fever and lymphadenopathy. If it is due to the novirgin scabies, extensive lesions, pustule crusting, and also which involve the face, seen in diabetic and immunocompromised patients with kidney disease. Pediculosis, which is, you can see several forms, like pediculosis corporis is there, pediculosis capitis is there, pediculosis pityriasis pubis, and pediculosis ciliaris. These are the several forms. And for the pediculosis capitis, you can see the school-going children, which is 3 to 12 years. And which I told, several forms are there. For pityriasis pubis, you can see the in lice which have lay their eggs for few days, and the small appearance it will be 0.5 mm in length. This is the type of lice which you can see over the body, ciliaris, and head. Capitis, it is an infestation of the scalp by pediculosis humanus capitis. It's localized in the scalp, favoring the occiput and temporal area, and which they lay their eggs more at the base of the hair stalks. Clinical features: itching, scratching, which result to trauma and which result to oozing. And secondary infections, which usually result pustulation and abscess formation. Pediculosis corporis. It is an infestation of the body by pediculosis humanus corporis, which inhabit from clothings, and it suck the blood, which release mild toxin, produce pruritic sport, which means strong itching will be there, and result excoriation. The site like shoulder, trunk, and buttocks. This is for the ciliaris. Pubis, which is an infestation of the pubic and perianal hairs by Pityriasis pubis. It's usually transmitted by the sexual contact. The adult female lay the eggs and nets remain firmly adherent to the pubic hairs. Features like itching will be there, which result to scratching. The hair may be matted and thick crust of dry pus you can see with serum and blood. The patient may also notice tiny blood spots on their inner ears. For the diagnosis, we need to look up observed under low power of microscopes. Treatment: for the capitis, we can give 1% of gamma benzahexachloride, 25% of benzyl benzoate, and 0.5% of maltodextrin. Application: 3 application on consecutive days, followed by the tying a cloth on the scalp and shampoo after 7 days. Corporis need a scrub bath. Insecticidal dusting powder is needed. Then laundering and ironing the clothes. Pediculosis pubis: 1% of gamma benzyl hexachloride, 25% of benzyl benzoate, and 0.5% of maltodextrin. Since the application is usually sufficient, if it is necessary, we need to repeat after 3 days. Other treatment: good hygiene is needed. Secondary bacterial infection, which is treated with a broad spectrum antibiotics. Then itching, which is controlled by antihistamines. Thank you for listening to my lecture. Have a nice day.